my name's Catherine. I'm a GP down at Terrigal, and I also work at the Air and Respiratory Clinic. And I have lovely Karen here.
Hi Catherine, it's great to be here. I'm Karen Douglas. I'm a GP, been working on the coast for the last 30 odd years, and from the Terrigal and Avoca area. So it's great to be here, and it's a really important topic for us to be talking about today.
And on that, we would love any questions from the community, and we hope to answer questions. And over the next couple of weeks to next few months, we'll have lots of different GPs on our panel, and we'll just kind of broach some broad information on vaccines.
Yeah, it's good to just try and make this relatively easy as well. We're not going to pitch it high it's really to just discuss what's happening day to day and what's happening for our community.
Hopefully for our community, Central Coast, relevant in particular.
Yeah. Good.
Lovely. So tell us the two broad vaccines that we're hearing about.
Well, you've probably heard a lot of information coming. The media is just full of it every day. It's changing all the time. And I guess we now know, as of yesterday or earlier this week, we have now two vaccines that have gone through Therapeutic Goods Association, the TGA.
A very rigorous process.
Oh, very hard. And we know that these vaccines have been used overseas, and Australia has got to go through the same process to make sure that these vaccines are safe for Australians. So we have the two vaccines. One is the Pfizer vaccine, and the other is the AstraZeneca vaccine. They call it sometimes the Oxford AstraZeneca. You'll hear different names for them because they do have different names, and they're named as a scientific name. They're also named by what they're actually called, but I'm going to call it Pfizer and AstraZeneca. And the Pfizer vaccine is being used in the first phase of vaccination in Australia. It's the one we've heard about that's just arrived in Australia by plane in the last couple of days, under guard, and it's the one that we have to keep very cold. In fact, very, very frozen. And that is the one that's going to be used in just a small number of hubs around Australia, based mainly in certain hospitals, and it'll be used for our frontline workers and for our aged care, both workers and residents, and for those with disabilities in disability homes and their workers.
So really the people probably deemed most at risk of serious disease.
That's right. So the frontline workers are not only our medical workers, but probably more importantly, what we're hearing about more and more is those who work in quarantine. Yeah. Those who really are working with our Australians who are coming back into the country from overseas and staying in quarantine for the 2 weeks that they need to, and the workers who are providing care for them. So that's the hotel workers, it's our flight attendants, it's the people who are actually working day in, day out with our Australian residents. So
if we can prevent them from getting the disease, it's likely to protect the community first.
Yeah, and it's interesting with these vaccines, Catherine, that they're not necessarily going to prevent COVID-19. What they're going to do is they're going to, and this is the evidence, and it's really, really good evidence to say that it's going to reduce the severity of illness. It's going to really reduce the symptoms. It's going to reduce the hospitalisations. Yeah. And it's going to mean that if any of us are exposed to COVID and we do get infected with it, we're actually going to have a very mild disease, and that's been shown across the world so far.
From no symptoms.
From no symptoms, yeah. That's right, or very mild. Perhaps even just a consideration in a similar way that we get a common cold, so that we won't see the anxiety provoked by the high hospitalisations and the risk to our vulnerable community. So the idea about this vaccination is that it's safe both vaccines that are out are safe, and they're going to reduce the infectivity of this virus, and it's going to allow our community to be able to live without fear, really. So therefore, the more of us that get vaccinated, the safer our community is going to be, and we're going to protect our vulnerable, those who are vulnerable. So,
and I think we all recognise there's a lot of vaccine hesitancy in our community, which is understandable. It's a new vaccine. I did hear someone saying the other day that they're happy to have it, but they'd like to be last in line so they can watch what's happened everywhere.
Yeah.
But how many million people do you think have been vaccinated?
Oh,
so far?
I don't know. Did you?
We looked it up just then, 178 million people.
Yeah.
So in terms of being at the back of the line, Australians getting the vaccine now, we are really at the tail end of people being vaccinated, because it's been quite a rigorous process. But
and we are lucky because we're an island country, and we've managed COVID-19 incredibly well. We've got closed borders, we manage our borders well, and therefore we can watch what's happening overseas, and we've got time to understand what's happening there. And with so many millions of vaccines that have been given, if you look at the Israel information that's coming out of Israel already, they've vaccinated a very large proportion of their community.
70%.
That's right, and they've already seen in such a short period of time exactly what I was just saying, a reduction in symptoms. The amount of COVID that's actually occurring in their country now is very much lower. And the healthcare workers, they're actually very happy now that they can work in hospitals without seeing very, very sick people. So it is safe, and you will find that most of the medical fraternity will be vaccinated. There will be some employers who will actually perhaps mandate the vaccine, that their employees become vaccinated to be able to protect those that they're caring for. But there will be reasons why some may not choose to have their vaccine, and they may not be able to work in the roles where vaccination is important.
And to make our community safe, we've heard about herd immunity. In terms of this vaccine, I think they're saying quite a large percent of the population actually do need to be vaccinated to make kind of our country safe and back to normal living.
Yeah, I mean, herd immunity really is about vaccinating a certain percentage of our community and our population to be able to infer that immunity to those who aren't vaccinated. Yeah. And if you don't have the majority, and there's different percentages you can look at, then even those who have been immunised may in fact be infected. But again, the more we have, the larger number of people we have in community who can be vaccinated, the better we are to actually infer that immunity to everyone. And that's the really important, I guess, message really that we need, is to say, don't be afraid. And the other thing I think that's really important, Catherine, is that when the vaccines are available, we talked about the Pfizer vaccine, which is in phase 1A, and that's the one that's going to roll out. It's the one we're hearing about. It starts on Monday, and the majority of us won't be vaccinated with that. We'll be vaccinated with the AstraZeneca vaccine, which is stored in a very similar way to our normal flu vaccines, our children's vaccines.
Given in the same way.
And given in exactly the same way. And that will roll out across the rest of Australia, in a slow fashion. It will be given as drip feeding really for most of us, and it will be controlled, so we don't all have to line up on day one and be vaccinated on that day. And what they've looked at is vaccinating in the second phase, which is actually part of the first phase, 1B, is those next group of vulnerable people in our community, and they are certainly our older patients, people or older residents who are over 70. It's our Aboriginal Torres Strait Islanders who are over 55. It's other healthcare workers, such as you and I, who are living and working in our community, and working at the coalface, and our staff who are perhaps more at risk as well, so that we can care for you when you're sick, and also for people who have chronic illness. So we know that on the Central Coast we have a very large population of over 80s, over 70s and over 65s, and many people with chronic illness. So we're all going to fit into that group. So we're going to have a large number of us in that group. And we can't.
But we have time.
We have time. We do, and we can't vaccinate everyone on the first day, and nor should we.
Yeah.
Because it's really important to do this in a way that's orderly, and we're lucky again in Australia. We can't travel overseas at the moment, so if we can take this year to be vaccinated, we will actually have time to vaccinate everyone. There are two vaccinations we need to have, or one and a booster dose. And it looks like the Pfizer, the first one, can be given within 3 weeks. But it will depend on when the availability of the vaccine as to when each individual gets.
And maybe even if it's a little bit longer between them,
no problem.
No problem, or even an advantage.
No, that's right. And we know from in England and some of the countries where the supply of the vaccine's been quite low and slow, is that they have chosen to vaccinate their whole communities with their first vaccine first before they even get the booster. So the period of time between the two doses will be prolonged. And again, we'll have time to learn how that goes. I guess knowing that we need to have one dose and then another dose, we don't have to be strict, as you're saying, in the timing of that at this point in time. And one of our difficulties we've always had with our flu vaccines, haven't we? And most of us will know that we don't always have the supply necessary to vaccinate everybody on the first couple of days or weeks that we have. And some of us in our practices need to start the vaccinations. And I guess that's another interesting question a lot of people are asking is about flu vaccines too, aren't they?
We're going to try and get those in between, or at least a couple of weeks after that vaccine, the first vaccine.
Yeah, if it's available. And I guess the question we still don't really know at the moment is when the flu vaccine will be available yet. One fantastic thing with COVID really is that we haven't seen flu. No. We haven't seen flu in the last 12 months.
And we also have our borders closed, so maybe there'll be less from overseas.
Yeah, and that's been one, certainly isolation, distancing, and catching our coughs and colds, coughs and sneezes has been a true advantage in the reduction in these kind of infections in the last, probably in the last 9 to 12 months. And so the flu vaccine's coming. It will fit in with this vaccine that we're doing, but we can't give it on the same day. Yeah. So if somebody's attending their own GP and the COVID vaccine is offered, or they come in for a COVID vaccine, they will need to wait at least 2 weeks if the flu vaccine's available as well, between those vaccines. So that will happen. Certainly encourage people to have a flu vaccine this year.
Like you said, it's a matter of people just kind of taking the lead and almost relaxing a little with the process. That will be very organised.
Yeah.
You'll be told what to do. It will be
absolutely
should be a nice flow to it.
Yeah, and don't bombard your GP surgeries with too many phone calls asking when it's there and when it is, because you'll find that your practice will reach out to you. They'll probably be communicating with you about when it's going to happen. For us within general practice and our community, you may have lots of options of where you're going to be vaccinated. May not have to be at your practice, could well be in little hubs that are around with, in a similar way to the way the GP respiratory clinic is running. So, those kind of opportunities for us will be there.
Yeah, so in summary, we'll hopefully have more of these chats with GPs like Karen or myself, or we'll hopefully have a panel of a few. The aim's to address your questions. If you have any about the vaccine, give information as it comes to hand, and hopefully the process will be smooth.
Yeah, and we're only encouraging as well for you to talk to your doctors when you see them. Please don't put off any of your other health issues. It's really important. We did find when we were in lockdown that many of us were a little afraid to make the call or come and see their GPs. Most general practices are now open and seeing patients face to face. We're so lucky, aren't we, that we have the opportunity to use the telephone, do telehealth, or to actually do some video conferencing with our patients now.
You need to be seen in person with your GP, don't delay.
Don't delay, and please make sure you do reach out to your practice for that information, but don't bombard them with so many questions that at this stage we still don't know the answers for. One of the things I again would also encourage is many of your practices, the general practices you go to, and many of the community settings will have information online. They'll have a website that you might be able to visit. They'll have a Facebook site or another social media site attached to their organisation. So we will try and share this podcast with as many outlets as we can to reach the community. So please share it. We think it's really important. Yeah.
So just to end, if the borders open, we're all vaccinated, COVID's diminished, if not less than a common cold, where would you like to visit in the world first?
Well, I'm sort of due to go to Japan to the Olympics to watch the last baby that I ever delivered compete as an Australian Olympian. So sad that we couldn't do it last year. I certainly don't think we'll be doing it this year, but I do hope for our athletes that we'll be able to watch them and see them compete this year, for sure. So what about you, Catherine? Have you got some
I think
plans?
just Hawaii, a beach somewhere far away.
I'll tell you what, the beaches in Australia are just magnificent. Inland, isn't it beautiful? We can see our own country. Yeah.
Okay, thank you. Thanks, Karen.
Yeah, lovely.